Hey everyone, I'm really excited to talk today about an important individual in the history of facial plastic surgery by the name of Dr. Suzanne Noel. Everything I'm talking about today came from a book I read on the life of Suzanne Noel by Paula Martin, published in 2014. Suzanne Noel was born in 1878 into an upper-class family in France, and she was an excellent student from an early age. She married a dermatological surgeon at the age of 18 who was 9 years her senior and who encouraged her to go to medical school. She went to medical school and was an outstanding student among the top in her class, and she graduated and began practicing with her husband at his office. Her husband went to the front lines in World War I and unfortunately suffered a chlorine gas attack that resulted in a severe injury, and he died of respiratory failure in 1918. Suzanne married one of her medical school classmates a year after her first husband's death, who ended up taking over her first husband's practice, because at the time French law stated that a male had to run any medical practice. Unfortunately, Andre Noel, her second husband, didn't submit a thesis to get his medical degree after he completed school. And so Suzanne ended up giving Andre her thesis, which was a device that sprayed micro droplets of water with medications on patients' skin to treat various ailments. It ended up being commercialized by them and became quite successful, sold all over the country. So he submitted this thesis and was accepted, and he started running this practice. They had a daughter who unfortunately died at a very young age, and this devastated Andre Noel. 2 years after the death of his daughter, he ended up taking his own life, and Suzanne Noel was left without getting her medical degree and with this practice to run. She ran the practice illegally for a period of time, became incredibly successful, but eventually had to submit a thesis in order to get her medical degree. And she was frustrated by the process that she had to go through in order to submit this thesis. So in order to slight the University of Paris, she wrote her thesis on the big toe, which has nothing to do with plastic surgery. It ended up getting accepted, and she got her medical degree, and she was able to practice medicine independently and legally. She unfortunately was not able to operate in hospitals because at the time in France, no one allowed cosmetic surgeons to operate in hospitals. So she operated out of her apartment and became incredibly successful, and she ended up building her own office and her own practice in a wealthy part of Paris. Her contributions to the field of plastic surgery are numerous. She developed multiple devices to help with cosmetic surgery procedures. She improved upon the facelift and the lower eyelid surgery. She wrote a textbook in 1926, which became incredibly popular. It was translated into many languages. And the interesting thing about this textbook is one of the first textbooks that incorporated photos of each step of the surgical procedures she was writing about. She also founded at the Institute of Dermatology in Berlin a department of cosmetic surgery. Weimar Germany, which was the German government between World War I and World War II, was one of the few governments in the world that was tolerant of cosmetic surgery. And so this was a unique department across the world. She was also very patient-centered compared to other physicians at the time. She would have long discussions with patients about the risks and benefits of procedures and what the preferences were as far as anesthesia. She even pioneered the use of local anesthesia for certain cosmetic surgery procedures. She would serve her patients lunch and tea after their procedures, and she cared deeply about concealing incisions while they were healing, going as far as dyeing the bandages that she wrapped around her patients the same color as the skin color of those patients. She was also dedicated to the health and life of children. She performed cleft lip and palate surgery on children. And it's for all of these accomplishments that she was awarded the highest honor in French society in 1931, which was a rarity for women at the time. So the lesson here is that we need to be open to all people and all ideas in our profession, because you never know where the next great idea is going to come from.